Welcome to today's webinar. Thank you very much for joining. It's great to see quite a number of you taking time out to join this webinar. Firstly, I'd like to introduce myself. My name is Paul Gooding. I'm the CEO and founder of People for Research. I've spent over 25 years in the research business, exclusively in recruitment and research ops. This is just a quick overview of what we're presenting today in the webinar. One of the first things, as we're in the industry of insights, is that I'll be running a quick poll amongst you, which we'll do in a moment. After that, I'll hand over to Vicky Karran, who is our Insights and Data Analyst, and she'll take you through the major findings of the survey that we've conducted with participants. After that, it will be Maria Santos, who is our Head of Marketing and Data Protection. Maria is going to take you through the findings from the feedback we've received from the client's perspective, but also from the social listening we've been conducting throughout this pandemic. And then after that, we'll have a quick summary and wrap up from Vicky and myself before we then go into the Q&A. This is scheduled for an hour, like I said, and we'll be keeping to that, that timing. So if we don't get a chance or opportunity to answer all the questions, we will answer those questions and release them in the form of a blog that we'll release very shortly after this webinar. So if I've got my technology set up right, and we're going to go straight into a poll first of all, and I'm just going to share this with you. So this box should crop up on your screen now. It's just asking the question is, are you considering face-to-face research? If you could all go ahead and enter, you've got one answer possible for this. If you can go ahead and enter that, then we can share the results for you immediately. I'll give you plenty of time or enough time to read that. I can see your results coming in, so the number of you voting and those left still to vote, and I'll give you a little bit more time just so we can get as many of you, many of the responses as possible. So in answer to the question, are you considering face-to-face research? It seems like the overwhelming majority is September onwards stroke, not until 2021, which is quite interesting and pretty much in line with expectations. So the next question we're going to ask is about one of the blockers stopping you from doing face-to-face research. So this should now pop up on your screen again. Again, this is a multiple choice option, so you can tick one or multiple answers for this if you'd like to select some of these answers. Okay, so plenty of you had a vote on this. I'm going to end the poll now and share this with you, share the results. So the results could be on your screen now. So seems like the overriding challenge is own personal safety. Is very high up there. Office enclosed, no facility, along with kind of difficulty in recruiting participants and transport to venues seem to be the main kind of headlines of that, which is really, really interesting. And again, is in line with kind of the information we're getting so far. So that's really useful. Thank you very much for that. Just want to give you a little bit of background to our credentials and why we've been carrying out this participant survey. People for Research are one of the UK's leading participant recruitment providers for user research, and we've been recruiting participants for over 25 years. We're focused on supporting the user research community in delivering valuable insights through reliable, high quality user recruitment. But as well as participant recruitment, other services that we provide include a survey service that targets key criteria and providing high quality completions. We've got a user lab based in our Bristol office. We also offer consultancy service for research projects, and we conduct international recruitment for clients as well. The purposes of this survey. So throughout the period of lockdown, we've run a series of surveys actually with our participant community. It's about their thoughts and concerns on how the pandemic is affecting them. And the last of the surveys focused on their thoughts about taking part in face-to-face research and about the specifics of attending in-person sessions. But we wanted to understand the level of support or willingness of participants to take part, And if they weren't, why not? To try and understand what their concerns would be. The purpose of collecting the data was to help inform our clients and the wider industry to guide them through the current situation and a route back to in-person research. We also wanted to know what the feeling regarding the appropriateness of conducting face-to-face sessions. Did this reflect negatively or otherwise on the companies or brands by doing so? What do researchers feel about face-to-face? And to help us form a comprehensive guide for the industry, we explored the measures participants would want to see in place and what their expectations were by taking part. Then lastly, these strands all come together to form a best practice approach to protect reputational impact. Whether you're working on behalf of a major brand or for the company itself, there needs to be an appropriate balance of doing the right thing at the right time. Returning to in-person research too soon could be very damaging for brands if you get that wrong. We'll be continuing to run this survey, and we'll be running our next one towards the end of July. If you have any questions that you would like us to include in that survey, by all means get in touch. Use the chat function, email us, contact us, and we'll do our best to include whatever we can in that survey. Again, these results will be shared, but as the situation is ongoing and moves quite quickly, just 2 days ago we had the announcement about face masks. We too want to keep on top of what those changes and how that impacts on participants' views and researchers' views as well. So I'm going to hand over to Vicky next, who's going to take you through the significant findings of the survey and share that data with you.
Thanks, Paul. Paul's already touched on this, but I just wanted to give an overview of how we actually ran the study itself. So as a business, we're in a really fortunate position whereby we have access to the thoughts and feelings of over 100,000 people UK-wide. So we felt we had a moral obligation to actually support during this unprecedented time with both our clients and participants. Now, Paul's already mentioned, but we have actually been running research throughout the pandemic to gauge how our community is responding to the climate. Interestingly enough, although maybe not surprisingly, we did find that there was actually a lack of trust of news outlets, government. You'll heard of clickbaiting. So we really felt that we could offer an unbiased, impartial, and I guess just honest feedback to our community. Now, the aim of this particular phase was to understand how the wider population feels when it comes to returning to face-to-face research. In terms of our approach, we've used quantitative methods throughout in the form of a survey. The reason for this is to provide a measurable insight and practical recommendations based on patterns of behaviours and our participants' preferences. Just to give you an idea of those involved, we had over 2,500 responses, so a really healthy and representative sample size. Within that, we had a diverse mix of ethnicities, life stage, employment status, and geographic spread. In terms of the data collection, the questions cover the practicalities and ethical considerations for our clients and professionals within the field to help navigate returning to some form of normality. Now, within that, we're exploring areas such as inclination to attend, what participants want to know ahead of attendance, what their top concerns are, what measures they want to see in place, and their ethical standpoint. As Paul mentioned, we will be making all data available at the end of the webinar, so you're welcome to digest it in a bit more detail if you prefer. So the overarching message is that 72% of people are ready to actually take part in face-to-face research right now. Now, that was far higher than we were expecting, and there is a real motivation for them to actually take part right now. There may be a number of elements that are coming into play here. The fact of the matter is, a lot of us have a lot of extra time. We're not going out, we're not socializing in the same way we once were. And the reality of people's financial situations may mean people are actually looking at sources of secondary income. Again, that may encourage them to take part in things like research in the future. And perhaps there's actually a shift towards understanding how critical research has been throughout the pandemic and will continue to be beyond it. It might also simply be that participants feel at this point in time they are ready to begin on a path to some form of normality. So how do we make this happen? Now, there are a couple of areas that we need to think about, as it's not as straightforward as what it once was. So what do participants want to know ahead of taking part? So informed consent does now take a different meaning in a COVID world. Then we're looking at what researchers need to consider ahead of running the sessions, and then what measures participants actually want to see in place when they are on site. And then finally, we're just going to look at the remaining 28% who just aren't ready to take part yet. Okay, so what do participants want to know? So informed consent has taken heightened meaning in the world with coded, with safeguarding measures being of equal importance to the research setup and processing of data. So we put it out to our community to find out what information is most essential for them to be able to make a decision on attendance. And these are the top 5. So hygiene protocol, as I think you'd expect. What participants want to know is what's being cleaned when, what are the touch points, what measures are in place between sessions, are there sanitizing stations, are we anti-backing? Think about the measures that you've seen in place out in shops, in restaurants, and in your own office. The chances are our participants will be looking for the same things. Then we've got PPE, a bit of a controversial one, depending on who you speak to. But given the guidance that's come out in the last couple of days, we might need to think about whether you're making masks compulsory for your research. Will you be providing them as the researchers? Will you be wearing them? Will participants have to wear them? Will gloves be required? Will screens be put up? Removal covers on chairs, for example. Then we've got being screened as safe. This is a bit of a tricky one because safe does mean something slightly different depending on who you speak to. It could range from temperature checks through to screening them about their movements or interactions within the last 14 days, and that could apply to both the participant and the researcher. You might want to think about, do you want someone coming along who's been to the pub every night of the week for the last 14 days? Then you've got the number of participants and researchers taking part. So this is really just a practical step, and it's things like perhaps one-to-ones are preferable over a focus group. If a focus group is essential, can we keep the numbers down? Can we have researchers observing remotely and only have a moderator on site, for example? Then you've got the number of people within the office or building. Now, this can get a little bit more complicated if you are in a co-working space or a shared building. You'll need to think about communal areas, cross-contamination in waiting rooms, for example, toilets, shared parking lifts, and kind of the list is endless on that. As an employee, business owner, or contractor, you want to think about what you'd personally want to know ahead of returning to an office. Again, those taking part in research are likely to want the same level of information. That could range from risk assessments to the layout of the room, right through to kind of the logistics of parking and transport. Okay, so what you as researchers need to consider. So it's not just about safeguarding participants. As professionals in the field, you also have guidelines that you'll need to adhere to, whether you're in a position to set your own and you have some level of autonomy there, or if you may need to comply with your organization or potentially even government guidelines. So it's also worth mentioning, and we've just touched on it, but your policies and guidelines may actually go beyond your own organisation. If you are in a shared building or co-working space, you might need to speak to building management, for example. So the first one on there is lab and studio access. So again, we're talking building policies, number of people within the building, and an overall risk assessment of your communal and personal areas. Then we've got authorization. So this is really, really critical, as you'll need to talk to the right people and get the right advice. The chances are you're not going to know everything about the implications of COVID when it comes to research. It might be you have to speak to legal. It might mean you need to speak to HR. You might need to speak to your line manager. Either way, it's really important that you know who it is you need to speak to and what authorization you actually need. The next one is company guidelines or policies. Now, every company will approach this in a slightly different way, but you do need to know that ahead of taking part, because not only do you, but your participants will also have to adhere to any guidelines or policies that you actually have in place. Now, the next is safeguarding. Now, this is both tangible measures you can put in place, screens, grids on floors, one-way systems, think IKEA, sanitized stations, but also it may involve things like, are you happy to involve key workers, those classified as vulnerable? You can be fairly liberal on who you involve, it's entirely up to you, but you do want to set out your stance ahead of time. And then we've got written consent. Now, Maria is going to touch on this a bit later on, but liability is something that has cropped up and we do need to be mindful of it. And again, this is going to involve you engaging the right departments, whether that's legal or HR, because you need to make sure you're entirely covered and kind of you've got everything in place that you know you need signed off by participants. Okay, so what the participants actually expect to see at the sessions. So the one at the top, which you may well expect, is 2 meters distance. Now, you might actually think, because the conversations government's having around reducing that to 1 meter, that this should also apply to research. So we actually put that question out to participants. And as it transpires, they'd actually rather keep the 2 meter distance enforced. So if you can run with 2 meters in your session, I would recommend you do so. The next one is hand sanitizer stations. Then we've got dividers or screens between participants, staggered sessions. So again, you might need to plan ahead of time on what might be a day's worth of testing, might now have to be run over 3. Then we've got anti-bac wipes, limiting the number of people within the building, and the researcher wearing PPE. Okay, and now finally, we just want to touch on the 28% who aren't ready just yet. Now, 1 in 4 people within this group have actually said they'd only feel comfortable taking part when all restrictions are lifted. So we are talking a little way off potentially. But 65.8% have said that despite not feeling comfortable themselves, it wouldn't actually cause them to think negatively about the company running research if they were invited. So the takeaway from this is that participants understand that it's their prerogative to take part in research. Equally, they entirely respect that it's your prerogative to ask them and invite them to take part. So you don't have to worry about them seeing that in a negative way, because by the looks of it, they do appreciate why it needs to happen and why we need to get back out there and doing it more regularly. I'm just going to hand over to Maria at this point, who's going to take you through feedback from other professionals within the industry and just talk you through some of the ethics.
Thank you, Vicky. So I'm just going to share some of the feedback from researchers and UX professionals we have been looking at since March. So let's start by looking at the shift in trends during the pandemic. So back in March, we looked at the industry trends and popular topics on social media platforms and around the web. Back then, the focus was very much on adapting all research to a remote context, the best tools to use, keeping participants engaged during online sessions, but most of all, there was a lot of chat about how to remain productive, how to keep team members engaged. So this slide shows a few of the questions we listed on a blog we wrote. We will send you a follow-up email after the webinar, as it has been mentioned, with all the relevant links in our report, so you don't need to try and find anything right now. There's going to be a lot of useful content in that email. So we started looking, like I was saying, into industry trends. And one of the big trends was ethics, and running any research at all during the pandemic was a question that was asked quite a lot. So we collected a bit of data from social media and we analyzed it to get some useful stats. So 45% of researchers at the time in March said it was a matter of analyzing each case, so case-by-case scenario, having a discussion internally and deciding whether that research was useful, it was urgent, they needed to run it. 40% were sticking to their regular research schedule, but they were changing all in-person activities to remote where possible. And a really interesting point, so 5% highlighted the possibility that all results collected during this period would probably be biased and therefore not valid, which is a really interesting point. So I'm singling out this topic of ethics because, as you'll be able to see, this is something that has remained quite popular over the last few months. So we kept listening to the industry's conversation during this period. And we have noticed a shift in the trends and discussions happening online, but also with our clients. So not just on social media and around the web. There is now a lot of talk about going back to a new normal. There's a lot of questions about going back to in-person activities and how to do it, which kind of prompted us to run the survey with our participants. The conversation is not about remote only anymore, which is quite interesting. And like I said in the previous slide, there is a lot of buzz around ethics. but it has shifted from should we do any research during the pandemic at all to is it ethical to ask people to attend face-to-face research right now? Does it put them at risk? So I thought it would be useful to share this tweet to help you find an answer to some of your questions, hopefully. This tweet is by design researcher and research ops member Emma Bolton, and she shared this short list of questions on Twitter back in March to help us determine if we should be running research back then. But in this case, you can adapt it to should we be running face-to-face research now? So these are quite useful questions. Is it necessary? Is it necessary now? Should we or can we do it differently? How can you minimize the impact on the participants, which is something we can help you with. But also, how can you take care of yourself as the researcher running these sessions? So take into account, you may have to listen to some unexpected traumatic stories from lockdown. In the website we created to share the data from the surveys we have been running, we shared a lot of information about how the pandemic has affected people's mental health. Remember, you may be one of the first few people these participants see for the first time in real life and have a real conversation with. Since the pandemic started. So having staggered sessions is not only useful to comply with your hygiene protocol, make sure you clean everything up between sessions, but also to allow you some breathing time between talking with the participants. So that's why we thought this list of questions was actually really useful, because it's not just, it shows the concern with the participants, but also it reminds you to be concerned about yourself and your well-being during these sessions. So just to show you in the next slide, how this change in trends is being translated into reality. Let's just take a quick look at the amount of, for example, usability labs already open and also preparing to open. So as you can see from the stats we're sharing in this graph, although around half of the labs we looked into, and these are just UK labs, by the way, are still closed or have no official updates or plans to open right now. So 38% reopened already or are reopening in July. And there's also a small percentage of 9% that opened in June, which is quite interesting. It was late June, the stats we saw for these, but still in June. So, but what about the researchers? So when we released the results of our survey with participants, we asked the professionals who requested our report that Vicky was talking about, what their opinion was about going back to in-person research. So compared to 72% of the participants that Vicky mentioned, only 55% of researchers and UXers are actually ready or currently have the means to consider face-to-face research. It's kind of a mixed bag. Besides capturing the yes and no, we also asked what the researchers' top safety priorities are. And I'm just waiting on the next slide. So yeah, thank you. So the access to hand sanitizer is at the very top of researchers' priorities. 83% mentioned this was their main requirement to be able to run in-person research. There's obviously the 2-meter distance with 64% of the votes, and access to antibacterial wipes with 60%. When comparing the researchers' priorities with the participants' feedback, the 2-meter distance and the hand sanitizer hold similar importance for both groups, as you can see, but participants are more keen on having physical dividers in place during the sessions. This is in their top 3 and not in the top 3 of the researchers, which is an interesting comparison. The other noticeable difference is that participants value more the option of having staggered options as an important part of the safety protocol, because obviously people are thinking about coming in and out of the venue and who they might walk past by, that kind of thing. So staggered sessions, again, just quite important for participants as a reminder that it should be part of your protocol for running in-person activities. So it's clear that there is a bigger split between the yes and the no sides for the professionals when compared to the participants, especially. This is obviously due to the fact that the people organizing the sessions have a lot more to consider than just deciding whether or not to attend. There's a whole list of things that researchers will have to take into consideration before making this decision. Some of the reasons why researchers don't feel ready right now are not feeling comfortable or safe, not having the means to do so. So either because your offices are only opening next year, for example, because you don't have enough space to stick to social distancing in your venue. You have a lack of budget for PPE, for example, which is also quite high in the list of things that participants consider important. There is a question about the ethics of running research right now, once again. And finally, not wanting to be liable for participants getting ill or for the participants' safety. So this relates nicely to my next slide about the biggest challenges. So to put some of the information from the previous slide in context, this is the data that we found around the biggest challenges researchers face right now when considering face-to-face research. So the second biggest one, as you can see, is liability. There are concerns as well around transportation for both researchers and participants, and time constraints caused by potentially having to stagger sessions. Some researchers also mention incentives. We've been asked about this by clients. We don't actually recommend incentivizing hire during this period because you want to avoid attracting people for the wrong reasons to take part in your sessions. We do recommend, however, offering to cover travel expenses or parking because this shows the participants that you do care about them and their safety, but obviously it also reduces the risks for you during the session. Finding the right users definitely sits at the top of the data we collected. And we know this is a huge challenge right now as well. We saw that from the poll we just ran with you. All attending. In the follow-up email we're going to send after the webinar, we're actually going to add some recruitment advice and important screening questions you should be asking right now if you're deciding to run in-person research. So hopefully that'll be quite useful for you, even if you're just planning how to get back to normal. So I'll hand over to Vicky now. She's going to summarize the main takeaways and then share a bit on how we can help you move forward, hopefully.
Yeah, thanks, Maria. So if you're going to take away anything from this webinar, these are the three things that I would recommend you put at the forefront. So the first thing, and I've been pushing this way before COVID, is putting participants at the forefront of your research. So now more than ever, ensure your research works for participants. This needs to be the case on both a practical and an ethical level. This will involve being entirely transparent, allowing them to ask questions and keeping them informed throughout the process. Ultimately, when participants feel comfortable and safe, you will get the best insights out of them. So it's in everyone's best interest. The next one is think practically about your project setup. Now, we need to think of it as a full 360 journey for participants. It doesn't start when they enter your studio anymore. It starts when they leave their front door. So you need to think through any additional travel requirements, communal areas, touch points, equipment, room layouts, and any interactions. Participant safety really has to become a major priority for user researchers. And the third and final one, which I do keep hammering home, is talking to the right people and getting the right advice. You're going to need to get authorization internally, probably from HR, potentially from legal, potentially from your building management team. And they'll be able to give you advice on ethics, consultancy, and how to run these sessions. The most critical thing I would say is plan early and make sure you have all the information you need to run these successful sessions. And just on that, we are happy to help. So we ran this research for a good reason. It's just as much for our participants as it is for you, our clients. So these are a couple of areas that we can help with, things like profiling. So we can talk you through key profiling considerations. Things like, are you looking to manage this with key workers who actually, incidentally, are far more motivated to take part in research right now? Are you considering running this with vulnerable groups? What might you need to offer them? Do you have to cover their transport? Are you looking to speak to business owners who, again, are actually far more inclined to take part in research right now than any other employment status? The next is research type. So we can help recommend which research type best fits your audience and how it can be ran. So for example, this could be practical things around can researchers observe remotely? Can we have one moderator within a room, and kind of keeping that safety in the back of our minds at all times. Then we've got safeguarding. And again, what safeguarding means will be different depending on your demographic, and you will find that they expect different things on site as well. Again, we're more than happy to help if you want to pick our brains on that. You also have to look at exploring what you expect from participants. So would you screen out someone that's traveled internationally, using public transport, who's not happy wearing PPE, for example? Then we've got the location. So we found quite interestingly that feelings towards research do vary by location, and this will become of particular importance as we start seeing more localized lockdowns. So if you don't have a set location in mind, but you want to pick our brains about where people are most inclined to take part, then please do let us know. We would be happy to help on that front as well. I'm just going to pass back to Paul at this point, who will talk you through some of our own safety measures and do a quick wrap up and Q&A.
All right. Thanks, Vicky. You talk about location at the end there, and Maria has touched on about the opening of user labs across the UK. We have our own user lab based in our Bristol office, and we are announcing an opening of that in the next few days once we finish implementing all the safety measures that we're putting in place. You're more than welcome to come and have a look. Check out what we've implemented, how we're doing it. We'll also be providing a guidance stroke checklist for the industry regarding operating a safe in-person research in your own venue or when using a third party like ourselves. There's going to be a bit like a GDPR type arrangement where we're going to want to see your risk assessment and you're going to want to see ours. There's going to be a lot of elements in sharing. All of that helps to ensure that the researchers are kept safe, but also that the participants can be fully informed as part of what Vicky said, that very heightened awareness or heightened need for informed consent. There's a lot more that has to go into that process. Lastly, we'll be sharing what we've learned from the feedback received from the industry and clients ourselves and from the research community on the topic of face-to-face research. We're really interested in your thoughts, particularly, as I mentioned earlier, about wearing a face mask, which now become mandatory as of the 24th in Britain, to be worn in shops. Are you in favour? Should they be mandatory? Should they be voluntary? Will this affect the session? So please do let us know. Use the chat function, send us an email. We can try and look at what your thoughts are and try and feed that into our blogs and information that we're going to release to help the industry on that journey back to face-to-face research. It's quite clear there is an appetite to go back to face, but with a lot of question marks at the same time. And it's about tiptoeing through that process to get back to that face-to-face research sessions. Questions. I personally can't see the questions, so Maria, I think, is going to pick up on those for us.
Yeah, so actually I'm just gonna go in order because Laura submitted a question and I'll answer to this one. It's about what was the sample in your social listening activities and what tools did you use? So there was actually a few different processes of data gathering and different sample sizes. So I'm just gonna list 3 examples for different things that I mentioned. So for example, for the topics on the social listening slide, we used Sprout Social and compared different keywords referenced in a bit over 5,000 tweets, I believe. So all of that information I have stored somewhere else. We can then add more information after in the blog we're going to write after the webinar. But yeah, so that was Sprout Social was the main tool for. I highly recommend the social listening feature if it's something that you think might be useful for you. I did try to look, for example, at Google Trends as well, but I didn't think it was as reliable, the data I was getting from it. So I stuck with Sprout Social, and like I said, the sample was around 5,000 pieces of content that referred keywords that are relevant to the social listening exercise that we were running. The data for the UK labs reopening, for example, that was a more manual exercise. So we just looked at a list of around 30 labs in the UK. We checked their websites, social media, found which ones were still closed, no updates. That's how we created that graph for you. And finally, another example. So the data we collected for the ethics question that was published back in March, that was also gathered using Sprout, the social listening, but also some manual research on Twitter. And the sample was quite smaller. It was around 100 tweets from professionals at the time discussing this on Twitter. But yeah, we did think, despite the difference in the samples and the exercises, it was still quite useful. And I hope that answers the question. So I'm just going to read now Gareth's question. You suggested not increasing the incentive to compensate for the extra COVID-related requirements. Is this because you think it may attract more participants that don't take the research seriously? So Gareth's just trying to understand the reasons for this, which is quite a good question. Vicky or Paul?
I can pick up on that quite happily. I think, yeah, it's a very good question. We spend a lot of time talking to our clients about the importance and the appropriateness of incentives and pitching the right amount. It's a balance of providing the actual incentive for them to go, but also not over incentivizing that you attract and pull in the wrong types of people that you put into those considerations. What we're talking about in terms of considerations right now, it's built on the back of the data that we received through the survey and that people's concerns in traveling to a session, i.e. using public transport. And so we're saying the focus should be looking at the participant's journey. As Vicky said, it starts from when they leave their front door. So that journey, when you think it through, is are they normally using public transport? Are they going to park the car in a public car park? All these sorts of things. So the incentive, we feel it's better to keep the incentive levels the same because that's appropriate, but to offer in certain circumstances, not everything, but in certain circumstances, be open to paying for, say, a taxi, where it's door to door, they're wearing masks. It's a much more controlled journey between front door and research sessions. So that's the thinking behind that, based on the research that we've got. So yeah, hopefully that's answered your question, Gareth.
I'm just going to follow up with a really interesting question from Fern. That wants to hear if the survey was just considering face-to-face research in a lab/office, or whether it also includes attitudes towards contextual research, so in people's homes, for example. And I know Vicky has the answer for this, so I'm going to hand over to her.
Yeah, we did actually explore the combination of what face-to-face means. So that could be focus groups, that could be one-to-one, and that can be in-house. Interestingly enough, we had also run a similar study about a year ago. And at the time, 50% of people had said that they weren't keen on at-home sessions for various reasons. They didn't feel they had the setup, maybe they're house sharing. And actually the inclination for them to take part in at-home sessions has slightly, but not by a great deal. And I think the same things still apply. I also think seen a slightly more high risk or slightly more intrusive if it is in home. If they're going to a studio, they can kind of control what they're doing as an individual. But if someone's coming to their home, there's far more considerations around, is the researcher kind of walking through your front door? What are their touch points? So I think their preference would be in a controlled environment on site or in a lab facility.
Thank you, Vicky. So a question from Helen. What would you recommend in terms of portable equipment / PPE if the researcher, is the person visiting other venues? And I think Paul, being responsible for setting up all the safety, like the safety protocol at user viewing, can answer this, I hope.
Yeah, absolutely. It's all about the pre-preparation more than anything else. I think that, as I said earlier, as a responsible research provider, you should be doing risk assessments on everything you're doing. So that includes the risk assessment for your own venue. If you're visiting other venues, then you need to request their risk assessment as well. Every venue that's open should have a comprehensive COVID secure risk assessment and process on how they plan to operate. To give you some practical examples, particularly in terms of PPE, we would be recommending that there are face masks available to be used, screen visors or face visors available to be used, both for participants and for researchers. But as a venue in particular, those are some of that's the information we would want to collect in advance, so that on arrival, all these are known beforehand. Again, it's down to preparation. There's talk of gloves being used as well. Again, that's something else in the PPE section you can have available to be used. I would say the best approach is to have those things available should they be required. I'm not sure with terms of if you're operating, say like a mobile app testing, whether gloves are going to work, because whether the touch contact's going to work with that device. You then have to have in place a strict hygiene protocol and how you deal with that wherever there's these high touch points. But essentially portable safety equipment, it is the mask, it is the gloves, it's going to be a visor. That's as much as what you can practically do as terms of portable. Within venues, there is also the option to have screens, but the main factor is going to be the 2 meter distancing is going to be the main criteria. And also how you manage those participants, how they flow in and out of that venue. Again, staggered start times does help with that.
Paul, I'm just going to follow up with an interesting question from Darren. So physical screens seem to sit around 50% for both participants and researchers. He's interested to know if PFR are planning to use physical screens or face screens or not at all. So user viewing in this case.
Yeah, it's a good question, Darren. We haven't made that final decision yet, particularly as they've just announced the mandatory requirement for face masks in shops. Again, that's something that we are looking at right now. Some of the discussions we're hearing and we're having about face masks is the impact it has on that user research session when you're in face-to-face format, and how does that affect that situation. So if that can be replaced by a screen, for instance, then that means then, yeah, undoubtedly we would have a screen and screen separation. But a typical setup you can have, particularly if you're doing a standard one-to-one session with an online platform that you're testing, you can have a slave monitor coming off of that laptop so the researcher can sit plenty distance away, 2 meters plus. They can see what the participant's doing, they can still hold that session, and then if for added safety, you can put that screen in place, then that makes that a whole lot better. Somebody did make a comment on a webinar I attended some weeks ago, which I thought was really valid, and that was about the theatre of safety. And what that is about providing these elements to make it very clear to participants and researchers that the safety has been thoroughly thought through, and that these measures are in place, and that there is a risk assessment, and so that creates this theatre of safety that people feel much more comfortable with. And so that I think the overriding decision making will be that if it's not going to impact or impede the session, then we might as well include it, because it's going to help that theatre of safety.
Excellent. I have a question from Jonathan, which I believe is suitable for Vicky. She actually touched on this during the webinar. Jonathan is asking if we have a breakdown of the respondents to see if those less likely to participate fit a specific user group. And I know we have this information, but I'm just going to go hand over.
Yeah, another good question. We do have that information on hand. It does vary. There's a number of things that come into play, even right down to gender. There's quite clear-cut things that certain genders want. The same with age groups. They want to see certain things on site. It really does vary. There were some surprising facts in there. For example, the 20 to 30-year-old group are actually have more concerns than those that are actually kind of over 65 and could be classed as vulnerable. So yes, we do have that information. If you have a particular audience that you're looking to run research with, please do speak to us and we can let you know what informed consent might look like for that group, what information they need and what they want to see on site.
Yeah, like Vicky mentioned during the webinar, we are here to help you, and this information is absolutely, it's completely free and available to everyone. So if you do have an audience that you want to check their availability or their preferences in terms of the safety priorities, just let us know and we can share that data with you. This report is completely open to the community. That's why we did it and why we're sharing it. I'm just going to actually merge two very important questions that we've received about people with accessibility limitations and assisted digital participants. So there's a couple of attendees to the webinar that are asking if we know the proportion of people with accessibility and assisted digital needs that are happy to attend face-to-face sessions, and also, so how, in terms of the accessibility people, how do they feel? So I'm just going to hand over to Vicky in a second. I'm just going to mention that I'm aware that in the sample that we collected data from, it includes everyone. So we did include everyone that is in our community, which includes people with disabilities. Vicky, do you want to add to this?
Yeah, so for anyone that doesn't know, I head up kind of unmoderated research at PFR. And if I'm honest, I actually think face-to-face works much better with those that may consider themselves low digital or have some degree of access need. I also recently read up on some research that says that those with access needs do tend to consider themselves low digital also. So I think it's really important that those sessions are moderated and that they have the level of guidance and support that they need whilst they're taking part in research. So yes, there will be more considerations, particularly if we require people with access needs to actually bring their own equipment on site. You will also need to factor that into your risk assessments. But I do think that that group in particular do see the value in actually taking part in face-to-face research and would appreciate that support and guidance that they'll have throughout, which they wouldn't otherwise have if it was unmoderated.
I think it's quite obvious from the way we collected this data, which was online, that is obviously makes the data a bit biased because it didn't include people who are very uncomfortable with technology. We do know from these, obviously it's just a fact that these people will be more comfortable attending face-to-face research because of their lack of savviness in terms of technology. But with our accessibility panel, for example, I think it's a really good prompt to maybe remind us to reach out to them and find out in particular their preferences and what they would like to see moving forward. We do have, just to remind everyone who's attending, we do have something called the Accessibility Collective, which is kind of a self-serve platform where researchers can access disabled participants directly in a much cheaper and straightforward way. So if you do have any questions that you need to ask directly to participants with disabilities, then this might be a good option for you. This is a great prompt, like I said, for us, however, to check with our accessibility panel and see what they think moving forward and face-to-face research, if that's a good option for them. I think there's some data we can extract from what we have at the moment. So we'll take a look into the report and the data we have right now, and we'll try to extract some relevant stats for the blog, because I think it would be quite interesting to be able to share a bit about this. If you are also interested in terms of accessibility, about what disabled participants have to say in terms of accessing news and official updates, that's quite a lot of data as well on our coronavirus-ukdata.com website. you can find it there. And I think there's one more question that I can just touch on, which is, I would like to know if netnography, which is quite an interesting expression that I haven't heard, or online communities are going to rise because of the pandemic. This is from Maria, and what an interesting question. And I'm going to be very honest, I think we all need to do a bit of research about this. And it's definitely a question for the blog, unless Paul or Vicky want to add.
No, I'll leave you with that, Maria.
The only thing that I will say is that I have definitely found there's been an increased interest in taking part in surveys more generally. So I do think that there has been a slight shift to those becoming more online, potentially demographics that weren't previously. The other thing that I'd read is that I think the uplift on people that were using things like online banking had gone up by like 70% for those over 70. So actually we might see that there are more online communities that come off the back of this, because people have definitely had to get online essentially throughout the pandemic to stay connected.
Yeah, I think if you look at the general data in terms of usage of devices, for example, in the US, I saw yesterday, I read an article about how people this year are spending 20% more time on their smartphones, which is a massive increase. And it's mostly due to the pandemic, obviously. There's been massive numbers of growth in people downloading TikTok, people subscribing to Netflix. So we know people are going more online. Again, on the data, the website where we shared the data from the surveys about coronavirus and the impact on people's lives, you can see there's so many more people using social messaging and Zoom, like we are right now, to keep in touch with family, friends, co-workers. So yeah, I think from my personal point of view, I think it's a yes, but it will be something it's going to be quite interesting to look at, I think, and include in the blog.
Great, thanks, Maria. I think as we're just approaching our full hour point now, I think we'll kind of wrap that up there. Any questions that have gone unanswered, then we will, I say, address those in the blog. Some really great points there about accessibility and information about that. That's definitely something we'll be looking at to include in our next round, which will be coming up in the end of July. Thank you all for attending. Any other further questions, please get in touch. I'm particularly keen to hear from researchers using face masks during sessions and your points of view on that. Please share, because we can help to build that information and insight for the across the industry. Great, thank you very much for your time, and we'll catch up with you soon. Thank you.